Now we'll have Dr. Morrison back, who's going to talk about complications of FMD.
All right. Hi again. All right, so I'll be covering complications of FMD and how do I know if I'm having one. So we'll first again start with hopefully a question. Yep. So who in the audience has experienced a complication related to their diagnosis of FMD? And it's maybe hard to read here. So it's I have not, and or I am unsure. And that's things like strokes, aneurysms, SCAD, dissections of any sort. I'll let you guys answer for a little bit. Okay. All right. So hopefully we'll kind of go through some major categories of complications and some of the major signs and symptoms that you should be looking out for, and hopefully make you a little less unsure. So some of the complications of FMD, these are the major categories we have. So dissection we've talked about is a tear in the artery lining. That's shown here in this figure. That can lead to either a heart attack if it's associated with the heart arteries. Spontaneous coronary artery dissection is what that's called, or SCAD. Can lead to stroke. There's also a risk of aneurysm and aneurysm rupture, and then a risk of stenosis or narrowing of one of the arteries. And that can lead to things like high blood pressure, kidney failure, chronic kidney disease, or peripheral artery disease, depending on where it occurs. And you can see this is a schematic, again, of the dissection, but also an aneurysm, and then areas of potential narrowing. So we'll first start with SCAD, and that would lead to something that is basically, or is, a heart attack. And so SCAD can affect the blood flow through any of the coronary arteries, and these are the arteries that sit on top of the heart and supply oxygen to the heart. So you'll see normal blood flow in this kind of schematic here, normal blood flow through an artery. Then there's a spontaneous tear or dissection that leads again to this false lumen. If there's significant bleeding in that area, that can lead to blockage of blood flow, and then lack of oxygen to the downstream tissue, which in this case would be the heart. That can cause a heart attack, or also called a myocardial infarction. And it's not typically related to plaque buildup. So reminiscing about Dr. Wells' talk, this is something separate than just plaque buildup leading to a heart attack. And it can occur in any of our three major blood vessels. So this is a schematic of the heart here on the right, and you don't need to know exactly what we're looking at here, but we have three major coronary arteries. The left coronary artery splits into two, and then we have a right coronary artery. SCAD can occur in any of these vessels, and it can occur in more than one at a time. The left anterior descending, which serves kind of the front portion of the heart here, that is most often affected by SCAD. And then as we know from today, FMD is the most well-recognized underlying condition in association with SCAD. And notably, SCAD can occur at the time of pregnancy, but it's not always associated. And so what are those symptoms associated with SCAD? Those are symptoms of a heart attack. So things that you may have heard before: chest pain, chest pressure, numbness, tightness. You can see from this picture here on the left, pain can really happen in any of these locations. So patients with SCAD have experienced pain in a variety of locations, including shoulders, neck, their upper stomach region, or chest. The pain may again travel to things like the jaw, the arms, the shoulders, the hands. May be associated with things like difficulty breathing, nausea or vomiting, or excess sweating. And then in severe cases, there can be dizziness or passing out associated with these. And so what do you do if you think you're having a heart attack? The answer is pretty simple. Call 911, activate emergency medical services. And so emergency room testing, what might that look like? We'll cover this, I think, a little bit more, but you may have a blood test that looks for heart muscle injury. That's called a troponin. You can get an EKG that looks at the electrical conduction system of the heart and whether or not there's injury there. And then there may sometimes be an emergent procedure or an urgent procedure recommended by way of a coronary angiogram, where we put catheters up, we shoot dye down the heart arteries. And that's a picture that we see here, this top arrowhead. You don't have to, again, know exactly what we're looking at, but this shows us a more normal appearing vessel. And then we see this tapering off right here that ends up with a very small vessel. That's a vessel that we think is affected by dissection or SCAD. Okay, so moving on to the next complication. The next complication is stroke. FMD can lead to stroke either by way of a mini stroke, or TIA, or it can be due to aneurysm, or it can lead to a full-blown stroke. That can be either due to underlying aneurysm rupture or something like a dissection in one of the neck arteries that either blocks blood flow to the brain or sends off blood clots to the brain as well. You can also have damage of the nerves around the artery affected, so that can lead to things like neck pain, et cetera, that we'll go over. Symptoms will vary depending on which artery is affected, on which side, in the front, back, et cetera. And so this is a picture of an angiogram of one of the carotid arteries. So again, taking a catheter up, shooting dye into one of the neck arteries. And you can see on this left-hand image here, this middle portion does not look like the rest of the vessel. So this is a more normal appearing vessel, and here is where we think a dissection may be occurring. And in this case, a patient required a stent or an intervention to open that up. And that's a more normal appearance of a blood vessel kind of after a stent was placed. And so recognizing stroke symptoms, the B fast mnemonic I think is pretty helpful. So starting with B, that's loss of balance or coordination, also may have that vertigo or dizziness like we heard. For E, that's eyes, that can be blurred vision, loss of vision, or double vision. Face, that can be drooping on one side of the face or numbness on one side of the face. And then similarly, arms or any extremity can be weak or numb, and that would be a sign of a stroke. S is for speech. You may have difficulty speaking, slurred speech, or difficulty speaking at all. And then T stands for time. So that's just really what to do. That's time to call an ambulance, time to call 911. I want to call out also if there's associated dissection, especially in the neck, there may be other things that are not these BFAST symptoms. So that's things like a headache, neck pain, eyelid drooping, uneven pupils, things like that. And then again, those stroke symptoms that we're seeing here. So again, what to do if something like this happens, call 911, don't wait, this is an emergency. Emergency room testing may almost always include some type of CT scan or MRI or some type of imaging. And then sometimes invasive procedures like that stenting procedure I showed you, sometimes those things are necessary, and then sometimes blood thinners are necessary, and that's really case dependent. All right, so our next one is aneurysm rupture. This one is overall rare. Obviously, we know that aneurysms can occur in FMD, and they can occur in several different artery beds, but we really worry about aneurysm rupture, especially when it affects the brain. And so when it affects the brain, the things that we're looking for, and this was, we talked about this in the last talk, but sudden onset, very severe headache, takes a very short time to get to peak, that thunderclap, worst headache of my life. Those are some of the things that we kind of learn to look out for as emergencies or signs that there may be bleeding in the brain. Again, there may be things like decreased consciousness or those stroke-like symptoms that I talked about prior. Outside of the brain, if there's aneurysm rupture, especially in the kidney arteries or one of the other arteries that feeds the gut, that could be abdominal pain, flank pain, and then if there's significant bleeding, some low blood pressure or shock, what we call shock. Again, in this case, if there is severe onset of new symptoms that are any of these that are listed here, that would be calling 911, going to the emergency department and not waiting. In case of an aneurysm rupture, an emergent procedure may very well be recommended. So things like aneurysm coiling, clipping, or even bypass in some cases. And lastly, we'll talk about stenosis. This is one of our less, I would say, emergent kind of complications of FMD, but can still affect us, of course. And again, this can occur in any of the arterial beds that are affected by FMD, and it can either be focal, which is this top picture here, where there's one area of narrowing, or multifocal, where anywhere along this beaded, lumpy, bumpy artery, you may have an area that's a little more narrowed than others, where the whole area may be narrowed. This again can be identified by imaging, so angiography, either CT scan, MRI, or invasive, and then ultrasound. And just because we see a narrowing or we see something that is concerning on a CT scan, that doesn't always mean it's associated with either symptoms or that it needs to be fixed. So that's when it's really important, if you have FMD, having your vascular provider go over your scans with you. If you've had an area that looks like there may be some narrowing, kind of asking those questions like, is this affecting me? And do we need this addressed, or do we just need to watch it? When it affects the kidney arteries, which is what we think about most often in FMD, we think about complications like high blood pressure, flank pain, blood in the urine, or just kidney dysfunction in general. Those are some things that you can find if there's stenosis in a kidney artery. So what do you do if you suspect there might be a problem? A lot of this is listening to your body, regularly monitoring blood pressure, and that can even just be at normal, routine visits, but it can be at home as well. Logging any new or persistent symptoms would be helpful, and then contacting your physician if those things occur. So if there's kind of new persistent changes that you suspect could be related to FMD, it's important to just ask and kind of have that conversation. And then if there's any doubt or if those symptoms become severe, don't wait, just present to the emergency department or call for help in some other way. All right, to conclude this talk, severe complications are overall rare. We've talked about some of the percentages in prior talks, but they can be serious and they can be life-threatening. And a significant proportion of you have told us today that you've had a complication of FMD. So knowing those signs and symptoms of heart attacks, strokes, aneurysm, rupture, stenoses can be helpful both when living with FMD or living with someone that has FMD, especially if there's things like stroke, et cetera, where the patient themselves may not be able to call 911 in that setting. And then ultimately, you guys know this, but you are your body's expert. So trusting your gut and knowing, this is different, this is new, this is severe. That's the time to not wait, don't take no for an answer, and come on in, call for help. That's it.